So I will start. I'm Aparna. And for me, I remember watching the numbers and watching the data coming out of China in January. And at first it seemed like, okay, people are not reacting to this. This must seem like something distant rather, like SARS or MERS, and it will be contained. But when I started to see spread and I started to see how infectious this disease was, and then I started to receive emails from friends in Europe, asking what our preparation response was. And I saw January go by, some of February, and not see a response, I started to get really worried. I traveled at the end of February to a training. And at the time, some of my family was abroad. And I remember thinking, they're gonna shut the airports down. Like, you need to get back. And they sort of responded with, no, I think things are okay. And that's when I really started to be worried or concerned that something big was happening.
Yeah. Alison, how about you?
The date I remember is February 25th, which was late in the grand scheme of things. I think when it was still primarily in China, it seemed, even though I'm a global health researcher, it seemed like something that was sort of over there and like other people would take care of. But on February 25th, I work at the Penn School of Nursing, and our media communications guy knocked on the door of my office and came in and said, hey, we need somebody to be the expert, sort of the media expert on the pandemic at the School of Nursing. Could that be you? And my first response was like, I know nothing about this. I'm not an epidemiologist. I study like behavior, no. And a few days later, I was doing a lot of local media on it. But it was that moment, like, like our school is going to need somebody speaking to the press about this pandemic. I guess it's time to saddle up.
Yeah, definitely. Ashley, so a bunch of people have just joined us, so I'm just going to repeat the question here. We're taking this moment to think back on what we were doing early this year. Was there a moment when you knew something big was going down?
I remember standing in my kitchen in mid-January and talking to my husband, and he asked, do you think that this is something that's going to be a problem in the United States? And at that point I said, at this point it looks like things are being contained. I'm not concerned right this second. And then the first week of March was spring break at Penn. And typically as a postdoctoral fellow, I go in that week. And it started to become clear that going in and out of the building may be risky, and that there was spread happening in many places. And my mom and my sister were actually traveling back from Florida and had asked before they left, did I think that it was concerning? And, you know, on a Sunday I said no. And by Thursday I said, I really think that you need to come home. And I have chills thinking about it now. It happened so fast.
Yeah, it really was that first week of March that it seemed like everything in the United States really shifted. So I'd love to hear from the viewers too, your own answers to these questions in the comment box if you want to share when you knew that something big was going down. And here's my next question for these three nerdy girls. What has been your biggest surprise over these last 6 months?
I will say something a little more uplifting. I think than my last response, not compared to others. I think the level of engagement from the general public now where we are currently, and even over the past several months, has been really impressive. People reading scientific papers, you know, people emailing me saying, I read this article in the Lancet, what do you think about it? Conversations I never thought would happen before. So that's been amazing. There has also been a great deal of information out there. And of course, we are trying to get the best information to our followers. But it also speaks to how much people want this information. So I think that's impressive. The other aspect is I see so much information coming from a variety of fields. You know, 6 months ago, I don't think I would have been reading, you know, papers from the chemical industry, or, you know, I would have been reading about AC filtration or, you know, spraying of chemical cleaning agents. These are things I had not thought about, quite frankly, and information it wasn't as freely available as it is now. So that has surprised me, but in a positive way.
So one of the surprises for me, and again, I'm a global health researcher, and one of the things I study is sort of participation in community-based public health campaigns, including in Peru, like door-to-door campaigns. And we don't do like door-to-door campaigns in the US anymore. There are very few things where like someone from the public health department knocks on your door. So for me, how we started to think, and I think we're just at the beginning, about contact tracing has been fascinating and surprising. Like we're sort of resurrecting this like basic 100+ years old strategy and technique for, you know, figuring out who's been exposed and giving them advice about quarantine or isolation. And I think the extent to which both like we're doing it the same way we've always done it is kind of surprising, but also the opportunity to innovate around it and move some of it to sort of tech-based and app-based, that tension has been wildly interesting and surprising to me.
I work in nursing homes primarily in my clinical practice, and we always say nursing homes aren't very sexy. You know, they're a place that
yes, they are.
They're sexy to me. I love nursing homes, and I have had wonderful times in nursing homes with amazing residents and families across really all ages. And we thought in nursing homes that we knew how to handle end of life and death. And this has really just sent shockwaves through nursing homes and across communities, and really challenged us in ways that I never thought I would see in my lifetime. And so it has brought my colleagues closer together to try to learn and take care of residents that are really ill, and to be there for families as they're dealing with these situations. But the loss of life has been really shocking, particularly in nursing homes in my personal and professional life.
Thanks for that. So I'm going to ask 2 of the last 3 questions just to throw you all a curveball, because we have a little more time than I thought we might. So where do you think we're heading? What's coming next, pandemic wise? What do you expect to see?
Oh, I'm first. Just realized.
Go for it.
So I'll speak more. I will speak. There are so many things I can think of. but I'll speak from my area of expertise, which is mental health. And I have some concerns. Some of our data is starting to come out around the toll that some of the measures we've had to take, including more severe lockdown forms, and even some of the restrictions that have been placed on our day-to-day lives, have really impacted the mental health of our general population, as well as our healthcare workers. And that means really anybody that works in healthcare, not just nurses, doctors, or other people. And that is concerning, because if you know about mental health, you know that in the United States, we do not have an extremely strong system. Some of that is payment related, and it is difficult to access mental health care. There are some positives as well. We've seen a great deal of telehealth services pop up, and we have been able to access people in a way, provided they have the technology to do so, that we haven't before. So I have worries, fears about more people experiencing, even if it's not a diagnosable mental illness, distress over the reality and the way forward. We know that this is a long game. We know that, you know, it's not going to be over in 1 month, and that things are going to be different, not necessarily in a negative way, but they will be different. So on a more positive note, I think people have been extremely resilient and shown that they are able to adapt. I think hopefully many of my colleagues will be able to meet some of the demand around that. I also anticipate that data will improve, and so that we can target our interventions better depending on who is experiencing these symptoms. So just a dash of hope there.
I've got a similarly sort of nerdy girl orientation answer that's close to my area of expertise. So one of the things I work on pre-COVID, my day job, is vaccine acceptance. So whether people will get vaccines or get their kids vaccinated. And, you know, hopefully there's an effective and safe, accessible COVID-19 vaccine coming down the line at some point. I don't think it's early 2021, but hopefully at some point. And one of the challenges I think we're going to face, and so one of the things coming down the pike for me, is starting to think about promotion programs and delivery programs that will optimize, maximize acceptance of the vaccine. So there's some survey work already that's showing already about 25%, 30% of Americans say they're unlikely to take that vaccine when it's available. You know, we're going to have a challenge just getting that other 70% to get it, but we really need to close the gap on acceptance. So trying to think now about promotion strategies, you know, behavioral, social science work that will communicate the safety, the efficacy of that vaccine, sort of the moral imperative to help us reach herd immunity. And that's work that can't start the day the vaccine is available. That's sort of stuff we have to start thinking about now, because it's coming.
Ashley, how about you?
So I think that it's hard to live in this sort of constant state of uncertainty, and much of my work, and as a nurse, but helping people make decisions is always based around uncertainty, and using the best information available to make the best decisions we can that are, you know, that fit with our wishes, that fit with our sort of our goals, and my hope for the future is that we become comfortable with constantly changing information and using that information to change our perspectives, to change our practices, but still staying true to ourselves, and learning together how best to move forward. But I think that that's going to require acceptance of uncertainty and the willingness to challenge some of our underlying beliefs to move forward as a society together.
I like how you all three, instead of predicting the future, told me what you hope happens in the future. FYI,
Optimism.
people, epidemiologists and clinicians cannot predict the future. So I'm going to give you a choice for this last question. And I've got 3 options for you. You can each pick whichever one you want to tackle. And again, I'd love to hear from viewers your own answers to these questions too. The first one is, what do you wish we knew right now that we do not know? The second one is, what's getting you through this moment in history? And the third question choice I've got for you is, what's the best thing about the pandemic? Aparna?
I will go with what is getting me through. When this first started, I remember thinking that 2 weeks was a very long time. And many of my friends, and now it's like, oh, that's just like a weekend. 2 weeks seemed like a long time to be home. And I kind of dug back in my mind, and, I have some training in cognitive behavioral therapy. And I just said to myself, Aparna, what is the worst possible thing that could happen? And I said that I'll be home for a year. And then I said, well, that doesn't really sound that bad. I'm an introvert. I like to read, there were so many positives I could think of. And at the same time, so many other people were having such a difficult time, March, April, May, and still to this day. So that sort of self-talk helped me a great deal. And I encourage people to even look up some of these methods if you're struggling with anxiety, which many of us have, and just constantly worrying about the future. My own personal practices have helped me a great deal of these ancient practices of meditation and yoga, which have been a big part of my life for the past few years, especially. And having that regular practice has really, given me some strength most days. I think also routine. It's like the one constant you can control, and having a daily routine as much as possible. It's easy to fall out of those habits when you're home, but sticking to some semblance of a routine, meaning differentiating night and day, morning to evening, and weekends from weekdays, and having a sleep pattern has really helped me get through. And finally, having some meaning in my work has been tremendous. I have this little picture up of Daniel Tiger washing hands, because I really enjoy working with children. That's a big part of what I do. And, I think being able to share information with kids in a fun and kind of interesting way has also been like an extension of all of our expertise, but I think also our work here at Dear Pandemic.
Should check out Aparna's video on mask wearing for kids that we posted earlier today. It's
adorable.
Really, really good. So I could easily answer any of those. Ashley, which one were you going to answer? And I'll answer maybe a different one. Do you know yet? Oop, you muted.
I can go with the best part, or I can go with what has gotten me through.
Okay, so I'll go with what I wish we knew. And it's on all of our minds at Dear Pandemic. I think we're going to do a whole week theme on it. I wish we knew how to get, especially elementary youngest kids, especially public schools, back to school this fall.
Yes.
And there's a lot we need to know underlying that, like how does transmission work for kids, but also how do we help large, complicated, complex public school systems organize teaching resources and facilities and everything. There's just so many puzzle pieces. And I wish we had kind of crystal ball plus will plus resources to know now that we could make that work for the fall.
So true, Alison. I couldn't agree with you more.
That would have been mine too, for what it's worth.
Yeah.
I agree that's one that I really hope to know. One of the things that has gotten me through and sort of reminded me of the silver lining, as Aparna was saying, is, being at home all the time. I have 3 young children. You're constantly turning on and off a switch to work and be with your family, to, do the dishes, but finish that manuscript. And it's really hard to move your brain between 2 spaces when you're in the same place, and, you could be interrupted 3,000 times a day. And so I started journaling when I sit down to work, to just sort of what have I accomplished? What am I thinking about? And it puts those thoughts in a separate place and really helps to focus the time I have on the task in front of me. And what it's done is has made my work a little more focused on things that I care about, and I've been able to say yes to things that are important, because it's hard to focus on things that are that I'm not passionate about. But it also has made me realize, how much time I'm getting to spend with my children that I probably wouldn't have seen otherwise. And when I'm in those moments, to really hold on tight and enjoy them, even though this was totally not the plan. So I would say maybe answering both the what have I enjoyed, and how am I getting through this?
Great. Well, thanks to our viewers, and thanks to the three of you for joining me and thinking back a little bit on what feels like an entire career as a professional public-facing nerdy girl, and yet has only been a couple months. Again, thanks for joining me, and thanks to our viewers for watching. We'll see you soon.
Thank you.
Stay sane.